And this is the last thing we'll be eval on.
You're gonna,
No, lab
you
demo.
should be familiar with mixing this one and that one and the one from last week, cause it's just like your instrument tray setups, you don't know which one you're gonna get. And plus, this is your chance to practice. When you're out in the real world, this all is really expensive. And they don't want you practicing when you get to the office, yes.
Are they gonna be set up for us, or do we have to know like everything we need for each one?
You'll need to know everything that you'll need.
Okay.
Yeah. I'm sort of saving you some time, but it's not really doing you a favor. I mean, you can look at the picture and you have your list of everything that you need. Just make sure that you have it. All right. So the difference with this is a little similar then to how the auto mix is, but I'm using the gun. Have you worked with these yet at all? Okay. All right. Okay. So
Angela, what is it?
It's a gun.
So a couple things you need to be aware of. So, this is just the gun for the impression material.
Okay, so it's just called a gun.
Yeah,
Okay.
yeah. So there's a little release button back here that moves the slide. So if you hear kind of a pulling on the teeth like that, I don't want to do it too much, that's going to take off these little ridges. And that's what moves this material through the cartridge. So always make sure that you're using the release to pull it all the way back.
You release it like a gun.
Yep, yep. So just press it and bring it all the way forward.
Which one do you like doing the most, Terry?
This I would say is probably the most common, but you're certainly going to be getting into more digital impressions over the next few years as it gets more accepted, more reasonably priced. So this system, there's different companies that do it. This happens to be, a GC product, but 3M also has a product too. So it gives really probably the nicest impressions, and that's.
So that one's the best, the coolest.
Yeah, I would say so.
It's pretty cool.
Yeah. So you're gonna have your gun and you're gonna have your cartridge, and this has your base and your accelerator in. Just like that auto mixer, this is going to be also an auto mixer, but it's a hand one versus the other one. So when you get it, you're always going to want to look for the little V that's on there.
And those are pre-filled already.
Right.
You just get
Yep, you just buy them. So, and then you're going to look for the little V down here. So it only goes in one way. I also say generally the reading so that you can always see the writing. If it was upside down, it would be a little harder to read. So it only goes in one way. Seems like it goes in this way, but it moves around. So I put it in and lock it down.
Is that empty?
No.
Now it's fully loaded.
So I have enough
Not
material in right here, so that's why I brought in a second one. Because what if I needed some more? I've got a second one here. So now I'm gonna, this is your little piston, same over there. I need to move it down into place.
And what material is this called again?
This is a polysiloxane.
Okay.
Okay?
Polysiloxane.
All right, so you just bring it all the way down. If it was out here, you could click it down, but just bring it all the way down. All right, so we're gonna do a prep tooth, and then so what we're gonna do is we're gonna just remember if we had a tray, are there any trays in there that don't have perforations on them?
Oh, there's one on the other end.
Okay, yeah, that one's actually. So remember, if you have a tray without any perforations on it, gonna have to use an adhesive on it. And that needs about 5 minutes to dry. So you're not probably gonna do it right when you're giving anesthetic, but after you've prepped the tooth, they're gonna put in something that does gingival retraction. There's different materials for that. That's probably going to be the time that you put the adhesive. So always make sure that that's part of your setup. If you have perforations or you're using a triple tray, generally you won't need the adhesive on it. So same thing, this tip, this is just the auto mixer tip. So when I take this tip off, this is going to go on here. So that's what's going to mix this material. So no more hand mixing. And then we have an intraoral tip that will go on it so that this then gets passed to the doctor And that's everything that's used intraorally. Okay?
That's pretty cool.
But to help kind of take up the room on the tray, we're gonna use a putty system. So obviously always use the same scoop with the same colored putty, because one is a base and one is an accelerator. And these are reusable, don't throw those in the garbage. So for us, we're just gonna be doing a quadrant. So we're just gonna do 1 scoop of each. If you had to do a full arch, you would get used to the material, but you're probably gonna use 3 scoops probably for a maxillary and 2 for a mandibular. And you wanna just keep them separated. They're fairly stable. They can be out for a few minutes. But if you have a 2-hour appointment, you don't want them sitting out there for 2 minutes. So what the putty does, and we're gonna do it as a 1-step. Sometimes they'll mix the putty, put it in the tray, put a little spacer, like a little piece of plastic, because what it's gonna do is it's gonna turn this stock tray into more of a custom tray. So everybody's teeth are a little different shape. We're gonna do it all in one swoop. Alright, so a little bit of things. So with this cap, just quarter of a turn takes it off. Now and then you can get your intraoral tip onto here already. Some of them you can buy this all as one. Some people will just use just the auto mixer, and so they want the opportunity to put the tip on or off if they're gonna use it. Okay, so these little notches. So if you wanna take a look, there's a little notch right here on the top of the thing, and just fits right in there. See how that little notch is kinda lining up. So it's on there, it lines up, but I still need to make the turn. So there's a little notch right here, fits in right there. If that doesn't line up, nothing else is gonna work. So I've got it on, now I turn it. I don't want to engage this yet, because once it starts coming down this tip, if I'm not ready for it, it's gonna set up in the tip. So we're gonna wait to make sure that we're ready, like, got the tray adhesive, I've tried it on. Is it gonna, it's gonna cover the teeth that I wanna cover. So I'm first gonna extrude a little bit out just to make sure it's ready to go. And the doctor's like, okay, we're ready to go. I'm gonna get that ready first, pass it to the doctor. They're gonna start syringing around the tooth. While they're doing that, I'm gonna start mixing the putty, filling the tray, and they're still gonna have the gun. And once I'm done, I'm gonna make an indentation. So I need to know which tooth I'm doing. So I'm gonna make an indentation right over the molar area. And then I'll hold the tray. The doctor will fill in that area. I'll take the gun from them, hand them the tray, and then they'll take the impression. Of course, you have like 1 minute to do all of that. So you wanna make sure you have everything set up.
Wait, I'm confused why you need to make the indentation if they're just gonna fill it again.
So I'm gonna press it down. So the putty is gonna be in here like a big rope. I'm gonna make an indentation where that tooth is, just to kind of start the material going where I want it, and then they're gonna fill it in with this is a wash material, fill it into that spot. So when they go over here, they've got material on here, material in here, so they'll go together.
Okay.
Okay? All right. Everybody ready?
Uh-huh.
Doctor says we're ready. Patient doesn't have to go to the bathroom. And so we're all ready to go. So we're gonna bring it out so you can start seeing it starting to mix through there. I'll make sure that a little comes out of the tip. Pass this to the doctor.
Thank you.
They're gonna start filling up right down in the box opening first.
Like you did with this too.
Right. In the meantime, we're gonna take the putty, mix it together. This also helps to kind of bring it closer to the patient's body temperature, even though they're probably numb there. Everything that goes in the mouth feels cold to them, so this also helps.
So that should turn green, because it's blue and yellow?
Whatever color comes out, I guess. So I'm
Okay,
trying to get
so
rid of all of the streaks.
Does
Alright.
it look green to you?
So with a quadrant, you're gonna do a little sausage or cotton roll shape.
Sausage sounds good now. I'm hungry. Mm-hmm.
Okay, so now I'm gonna make my indentation of where that prep tooth is.
Okay.
So now you've basically made a custom tray just for that tooth as you think about where it goes. So I'm gonna be holding it, oops, sorry,
Throwing things around.
and the doctor's gonna fill that up.
Why is it going on so slow?
Alright, so you'll take this, they'll take the tray. And I'll seat it right down on there.
Okay.
So it wants to be seated enough so that you get some that come through the perforations, because that's gonna retain it. Because we didn't use any adhesive, because we don't need to, because it's a perforated tray. Alright, so clean up, same thing.